Hi everyone, welcome to the Dr. Jason Show. So excited to have you. We've got a wonderful show today. I have with me Dr. Soliman. He is a colorectal surgeon and chief of surgery at Florida Hospital. And we're going to have a wonderful time. He's got some healthy living tips for us for 2017. We're going to also ask some tips about what he does personally. And, you know, everyone wants to know this question. So, you know, how do I know if my stool is healthy? I mean, I got to ask that question.
You have to lead with that question?
I mean, that's what everyone wants to know. They want to know if they have healthy stool. People want to know. I mean, honestly, if you think about it, most people, I'm just saying, most people think about, hey, you know, they know something doesn't look right, and they go and seek a doctor and say, you know what, I've noticed, I've had, you know, dark stool, I've had bloody stool. So it's actually a common question that I get even in the primary care world. But no, seriously, I mean, you got to get that question too a lot, I'm sure. I mean, right?
Yeah, well, thanks first for having me. It's been a lot of fun.
You're welcome.
Great.
You didn't like the lead about the stool? That's okay.
So, yeah, I mean, to start, stool are like people, right? Multiple different types.
All right.
Multiple different colors.
All right, yeah.
Multiple different, I don't want to say flavors if you will. You get all sorts of types.
Please.
But, you know, reality when it comes in, what it is whatever goes in must come out, obviously.
Right.
If you think of the intestinal tract as one long pipe,
Okay.
Bacteria in your small bowel and your colon, everything has to churn and kind of digest and absorb and do all the nutrient absorption that's required to absorb as much of the nutrients as possible. And ultimately, the waste comes out. And kind of whatever comes out at the end is indicative of what initially went in.
Right.
And so, really what healthy stool looks like is, you know, anything that's kind of...
So if I have bad stool, something bad went in.
Yeah, pretty much, or something bad is kind of brewing in the intestinal tract, such as, you know, normal, soft, fluffy, brown stool. Oh my God.
We should all have that, right? We should want that. We should seek to have normal, soft, brown, fluffy stool.
But there are some variables. There are some things that will vary the type of stool consistency that you have, such as high fiber diet will allow the stools to
we
be
get fiber from apples. We get fiber for anything with a nice
We're going to get into it, my man.
Okay, we're getting into it. You shouldn't say that when we're talking about stool.
Yeah.
Anyway.
So, yeah, you know, things that would, you know, certain things, higher fiber foods will tend to clump the stool together and have a more, we call it efficient evacuation, efficient bowel movement.
Okay.
And of course, other things that you take in, like...
I got to put a plug here. My food map will help you with stool. It'll help you have the good kind of stool. If you have the type of fiber that's on my food map, you got to get it. I'm telling you, but it's important. We all think about it.
No, there's no doubt. I mean, actually, I will always say this to my patients. The more fiber you have in your diet, the less likely you are to see me.
Really?
Yeah. So if most people had a diet that was high in fiber and high in water, I would likely be out of business, and I'm totally fine with that.
Okay.
There's other things I can do with my career.
Okay.
Than take colons out and deal with cancer. And
well, let me ask you this. So what type of foods do you recommend? What are your highly rated fiber foods, so to speak?
It's a great question. And so usually what I'll tell my patients is, I don't care how you get to it.
Okay.
But I want you to get to 30 grams of fiber in a day.
All right.
And I'll say I'll say anywhere from 25 to 30 grams of fiber a day and 50 ounces of water.
Okay.
That fiber, I couldn't care less what it comes from.
Okay, you don't care.
It can come from cereal. I usually recommend Fiber One cereal. It's quick, it's easy.
Okay.
You get a bowl of it in the morning, you're pretty much done.
Right.
And I say count your fiber like you count calories. Look at the back of a box. It's going to say, you know, this piece of bread has 5 grams of fiber. Okay, that's 5. I have 25 left for the day. And then you kind of add up throughout the rest of the day. Things that are high in fiber, we talk about it a lot in your food map.
Right.
You know, the undigested leafy vegetables, those tend to have a lot of it. Kale has a lot of it. Certain starches have some fiber in it. God, you can tell me even better than I can tell them what's high in fiber. But certain undigested green leafy vegetables are definitely the ones that are super high in fiber. And again, however you get there, doesn't matter how you get there, but get to 25 to 30 grams in a day.
Well,
also 50 ounces of water, and you're solid.
You're right. And what I like to tell people, right, exactly. I think you got to. There's a lot of puns here. There's a lot of puns here. I'm telling you, it's a sensitive subject, but we all want to know about it. We all want to know about it.
If my mom was watching this now, you know how much...
Is she on Facebook?
No, thankfully.
That's right. You're gonna have to call your mom. You gotta let her know that we're all on fiber thanks to you.
But how much training I have to go through? Now we're talking about fiber. That's a good topic.
But that's good. I mean, you spent like 8 years of training.
Yeah, I'm doing it for real.
But it all boils down to stool.
Yeah, so, it comes down to
that's what it comes down to. I'm just saying. You know, I have to say, and that's one of the reasons. That's one of the reasons why I always advocate having good salads, you know, during lunch, because when you have salads during lunch, you know, you're going to have good stool, is one, but at the same time, you can get the fiber in. You can get the fruit in that you need to get the good fiber. I'm sorry, this is...
So let me say to you for a second. So red flags you need to look out for. Like for real red flags you need to look out for. Dark black stools. Those can be indicative of an upper GI bleed.
Right.
And actually what happens is bleeding in the stomach, the blood or the heme, or the hemoglobin, that ends up getting digested through the GI tract can actually turn your stools black. Kind of a red flag, we want to know about it. Bright red stools.
Yeah.
We also want to know about that too. That's something definitely want to see your doctor about.
Yeah, but lower GI tract bleed.
Right. Yeah, exactly.
Yeah, and what about clay-colored stools, yellow stools, things like that?
Well, that's a great question too. So a lot of the clay-colored stools, yellowish colored stools, even white-colored stools can be indicative of other bile malabsorptive issues. So bile is actually secreted by your liver. The liver basically secretes bile to allow to digest, break down, and absorb fats and certain nutrients in the body. And then when you lack that bile, that's what ends up turning your color clay-colored or white even. So actually that could be a serious problem too. If you have these light white-ish colored stools, I'm not even going to scare the audience, but there's some other things, you know, pancreatic cancer, bile duct tumors, and all these other things that
But this is important because if they see that, that's when they need to pick up the phone, call their primary care doctor, or give you a call.
That's exactly right. You know, I always say this also to my patients that if people get their colonoscopies regularly, you know, colonoscopy basically just looking in the pipe to make sure that there's no premature growths growing that could potentially down the road turn into cancer.
Yeah.
Colonoscopy is a life-saving procedure. And if you get it done, we find precancerous tumors all the time. I'm 36.
Yeah.
I've taken care of probably 10 or 15 patients my age or younger last year. I've done resections, and prostatectomies, and given them permanent coloscopies because they had early tumors that we didn't detect soon enough because they were young. I had my own colonoscopy done.
Wow.
Just because of that. I'm probably telling too much to the world, but I did it.
We're talking about stool.
Yeah, it's true.
So, I mean, I think nothing's too much at this point.
At 36, had a precancerous polyp growing in my right colon.
Wow, 36.
36, and I have no symptoms, of course. And I knew at 5, 10,
but how do you know to go ahead and do that? Because regular screening guidelines, they talk about, you know, when you're age 50, that's when you should get your screening colonoscopy. If you have a family history of colon cancer, get it 10 years before that. I mean, there's more detailed specifications than that, but in broad strokes, those are what some of the screening guidelines are.
Yeah, and so for me, I went because I was paranoid because I'd taken care of so many patients my age.
Wow.
And so I was a little bit more proactive to get it done sooner, and thank God I did. Those that, like you said, those that have a family history need to go sooner. Those in the African American population need to start their screenings absolutely at 45 or before. Or absolutely at 45, even before if there's any sort of symptoms.
Yeah.
And those screening guidelines are only if there's zero risk and zero symptoms. If you have symptoms, you definitely got to go sooner.
This is so important for people to know. I mean, what kind of things, you know, whether it's food, exercise, what kind of things can people do non-invasively so that they can stay healthy, so that they can lower their risk of having colon cancer or lower their risk of having any type of GI problem? Yeah,
it's a good question. And the truth is, when it comes to colon cancer, the biggest thing that you can do to prevent the development is getting a colonoscopy, period.
Okay.
There are some anecdotal studies that talk about high fiber diets and also those with low red meat.
Okay.
That's not really the problem. Is the studies that have suggested that a low red meat or low smoked meat diet or a high smoked meat diet cause colon cancer have not really panned out to statistically and in a large population study prove that actually develops colon cancer. But in certain mice studies that they've done in labs with super high doses of the oxidants that get some of the chemicals that get produced when you smoke meats, and super crazy high doses, they can develop colon cancer.
Wow.
But we've never demonstrated that to actually, in huge population studies that are well designed, to actually demonstrate the correlation. But as we always say, moderation is key.
Moderation, yeah, that is key, because people who take that type of mindset don't get too extreme, and they can pretty much live a nice, healthy, productive life. That's powerful what you said about screening, about people being proactive, looking out for warning signs as far as their stool and everything like that. You know, it's a new year, it's 2017. What personally can you tell our audience and our Facebook world here about just things that maybe even you do yourself to stay active and healthy?
So one of the, talking about colon health and digestive health in general, actually one of the biggest things is staying fit and staying healthy and eating well. Because actually, there's no doubt actually obesity plays a major risk factor in development of colon cancer and other gastric related issues, diverticulitis, which is an infection of the colon. All sorts of other rectal cancers, especially much higher in the obese population. So, when I was in my training, we did a significant amount of bariatric surgery, and bariatric surgery is weight loss surgery. And I remember walking in as an intern. The intern was the youngest guy on the team, and we would do all the paperwork to intake the patients, what medicines you're on, what blood pressure medicines you're on, all the medical issues that you have. And I remember walking in and having patients on 20, 30, 40 medications. Yeah. Diabetes, blood pressure, whatever, you name it, they had it. We would do their bypass operation, do their bariatric operation, and literally discharge them 2 days later. Wow. Off everything. Wow. And it's not because we did any magic in surgery, but what we were able to do with bariatric surgery is we were able to mechanically restrict how much food a person eats. Yeah. So there's a mechanical restriction to it, and of course there's a malabsorptive component where they don't absorb as much. But there's no doubt, the less you eat, or when you eat in moderation, eating correct amounts, actually will decrease the chances of you dying from cardiovascular death, from dying of all sorts of other things. And so, like I'm saying, patients would come in diabetic, they would leave 2 days later non-diabetic.
Wow, that's powerful.
And that's only because they're now forced to diet. So, as a healthy message, stay and eat healthy, exercise right, and you will prevent all sorts of, a whole host of issues, diabetes, high blood pressure, cancers. Right. Because you are at higher risk for those things.
Well, that brings an interesting point up. Again, with bariatric surgery, you're forced to diet. Now, for people who don't undergo that procedure, but they do want to lose weight, small portion sizes when they eat could be, their pseudo-bariatric procedure, so to speak. What do you recommend? When you're talking about what's on your dish, what's on your plate, portion sizes, are we talking about, like a handful, whatever it is, whether it's meat, whether it's vegetables, or what would you say to that?
So let me answer that by telling you a story. My wife and I, when we got married, we were almost going to be married 10 years now. And we did our honeymoon actually in Australia. Okay. And this is when I was in residency. So we landed from the plane in Australia. We landed in Australia, in Sydney, Australia. We got off the plane. I looked around. My wife's like, "What's wrong?" My jaw dropped. I opened up. She's like, "What's wrong?" I was like, "What's missing?" She's like, "What?" I was like, "Fat people." Wow. I was like, "There's not that many obese patients here." And I'm on bariatric surgery. I've been doing bariatric surgery for 5 years of my career. And it's true, actually, the majority of the times that we went to restaurants, the portions were like driving me nuts. Because I order a steak, it's like a 4-ounce steak. I order a side of, mashed potatoes, it's like a little tablespoon of mashed potatoes. They, in the European culture, and it's actually one of the reasons I can't stand traveling to Europe, is because they don't have free refills on Coke. Really? Or Diet Coke. Or but it's true, they know how to portion control.
Portion control.
So portion control is absolutely key. So, like you're talking about, it's going to depend on your metabolic rate, going to depend on your size, and depend on your level of activities. And so there's all sorts of rules of thumb that you can kind of look at. But some, you talk more about it on your blog and all. But more I'm talking about like meat the size of basically a deck of, wheat whole.
Open it up for the audience back here to see if you guys have any questions.
No more poop questions.
I guess that's off limits. It's really not. But, if you have poop questions, that's fine.
I've got a question. why do you believe that you're starting to see people at younger ages develop issues that generally were more in populations where someone was 50 years old or something like
That's
that?
a great question. You know, there was actually a study. There was actually a study just published. It was a huge population study that looked at, you know, we as surgeons were anecdotally, just kind of coincidentally seeing the colon cancer age to younger and younger and younger. And the truth is the majority of colon cancers are sporadic. There's no genetic lineage, there's no reason for it to develop. We don't have a good explanation for why that is. We don't. I can speculate, a lot of us can speculate, because now the U.S. has a 37% obesity rate, soon to be almost a 60% obesity rate by 2020 if we keep going at this rate. If obesity leads to malabsorptive issues, which leads to issues with incidence of increased colon and rectal cancer, that could be, I'm not saying it is, but that certainly could be one of the reasons why younger patients are developing. But we have no data to support it. But the data that we do have to support is that it is, the incidence is getting higher in younger patients. So please, I implore you, I beg all of you out there, any issues, any complaints, any family history, get screened. It's way easier to get screened and have me annoy you for a colonoscopy than for me to take your colon or rectum out.
No, that's really good. Great question. I think we have time for one more question. Does anyone else have a question that you might have?
Go ahead. I'm wondering, you know, I also had to have a colonoscopy at a very young age, and I have them every 5 years. I have a family history. And one of the things people asked me, even when I was in med school and in residency, was, how was that prep? Was that really bad? And I'm wondering what kind of advancements have happened in the world of colonoscopy prep over the years.
So I always say the day I develop a prep that people don't hate, that's
gosh.
the day I'm retiring. You'll never see me again.
That's a business idea.
Right, but so there are multiple preps, because all preps are awful. So right, there's actually a pill prep now. It's called Osmo Prep. It's 32 pills that you take, and you drink a ton of water, but it works. There's the old-fashioned Go Lightly, which is it's a gallon. It's the safest medication, or it's the safest bowel prep that we have. We use it in our dialysis patients, use it in all those patients. There's actually another one called Prep-A-Pick. It's actually 2 5-ounce shot glasses. Chug, chug, and you're done. And that's great. So, you know, there's a multitude of preps. Some are not bad. The prep I did around my colonoscopy was a Gatorade prep with Miralax in it. I like Gatorade. I just chugged it. I didn't taste anything, and that was it. It's not bad.
These things just clean you out, and that's why a lot of times patients sometimes are compliant with the prep because it really drains you.
That's right. Nauseates them.
I mean, it's really the worst thing that people fear about colonoscopies, basically. The prep, not the procedure itself.
But preps, as you're saying, as you're talking about, they've gotten better. They're easy to take now. I mean, they're still awful because you got to poop all day, but they're not, you know, at the end of the day, they don't taste bad going in.
Yeah.
And, you know, it is a life-saving procedure.
Cool. I want to take one more question from our audience. Anyone have another? Go ahead. Go ahead.
Well, actually, I have family history, and Dr. Jason actually recommended that I go ahead and do that. What are some of the other things to look for? Because I'm not diabetic, and so I don't have a lot of other indications. But my grandfather did pass away from colorectal cancer.
It's a great question. So any sort of symptoms at all, such as change of bowel habits, it's a big one. So if you're a regular, like you're a 1 to 2 bowel movement per day kind of guy, and all of a sudden you go to 1 every other day or 1 a day, just the slightest change in your bowel habits can be indicative of something. May not, usually not, but it could just be a dietary issue. That's one thing. Bleeding, bright red blood per rectum, or really dark tarry stools. That's another one. Abdominal pain. It's unexplained by some other physical exam finding or something else. I mean, really anything to give us concern, or you to give you concern, especially in the case of family history, you get screened immediately. It's so much easier to get a test done than to regret it in the end.
That's a great question. Did you have one question?
The only other question is a kind of a piggyback on that. How do you know whether to get a full colonoscopy or a half or another types?
It's a great question. So back in the day, we used to do sigmoidoscopy followed by what's called a barium enema. We don't really do that routinely anymore. So you're just going to get it all, the whole thing. You're there, you've prepped, you're asleep. It's going to be amazing. We're going to look through the whole thing.
These are great questions. Thank you for that. I mean, honestly, thank you for being on the show. The questions have been great. Your answers have been great. I mean, we've learned a lot about a lot of different things.
Yeah, geez. Yeah.
And you know, it's really powerful. But this is serious in regards to making sure that you get screened, making sure you get timely colonoscopies. You know, colon cancer is really the third cancer when it comes to when we think about morbidity and mortality. You know, behind lung cancer as well as behind breast cancer. This is something that, you know, you want to talk to your doctor about, and you want to get screened. And you also do want to be cognizant of stool and things like that. I know it's sometimes funny to talk about, but you know, it's really important. Having a healthy diet, getting good fiber, getting good nutrients make a difference. Eating good food, life-giving food is so important. And that's what I talk about, again, on my food map that you guys can purchase at jasonnb.com, and you can download and you can learn what to eat as far as fiber, what to eat as far as elite fats, as far as elite carbohydrates and elite protein. Also, get the book, Energy to Go. As you know, we're having our Energy to Go book launch today. I want you to go and get that, because the things that we're talking about, you know, can really be life-saving, can really be life-enduring. And it's so important that you learn what you can do now, what you can do inside your home, in your kitchen, so that you can have good longevity, good energy, and really just good, wholesome life. You know, Mark, I thank you for being on the show. We learned a lot today. I really appreciate it. We definitely got to have you back. I want you guys to go to Instagram and talk back with me today. Go to my Facebook, talk back to me. Even after the show's over, talk back. Leave your questions. I'll answer them. I want to hear from you today. So excited that you joined us today. We had a wonderful time. We went a lot of things. Did you guys have a lot of fun today?
Yes.
It's just been amazing. I want to thank all of you guys for watching. I can't wait to see you soon. Listen, more energy to you. Get the book, and we'll talk soon.